Hey, it's Mikey the medic here from Emergency Response Experts, and today we're going to be talking about pediatric choking victims. One thing that's really important to remember is that babies and their bodies and necks and heads are far more delicate than adults, as we know they're not completely formed yet. The three main signs you're going to get when a baby is choking is obviously if the baby's cyanotic, you're seeing blue lips or a blue face. That's number one, call 911. Number two, you're gonna see baby become really irritable and maybe scratching at themselves. You'll see a little bit of that. Maybe their hands don't make it to their face, but you can see some clawing and some restlessness. And obviously listening to the baby, you're gonna hear a baby if they're wheezing. The signs and symptoms are gonna be there. And if you recognize any one of those three symptoms, call 911 immediately. The one thing about pediatric choking is it can go into cardiac arrest pretty quickly. So obviously we're gonna have our first aid kit on standby. We're gonna have someone call 911, come back with the first aid kit, and come back with an AED. But right now, I'm gonna show you how to dislodge a choking item in a pediatric. Here we have our choking victim. Hey baby, hey baby. All right, one thing also that's really important to remember is we're never gonna do blind sweeps with our fingers. We're never gonna stick our finger in the baby's mouth and feel around for things in there. Obviously you can get bit, it can cause a piece of skin to dislodge, it can cause other issues that end up with another element in their throat that we need to dislodge. So we're never going in and just sticking our finger in there. Moms, I know you probably do this a lot, but not the best idea. The first thing we're gonna do is position the baby into a rescue position for choking. So we're going to use our hand and our thumbs to caress the baby's back of the head and the neck. We're going to kick those baby's legs on either side of our arm, straighten out our leg, and we're going to let the baby rest on our upper thigh with the head facing downwards. The first thing we're going to do is deliver 5 chest thrusts. So we're gonna line up our nipple line, take our 2 fingers. Remember, we're only going 1 inch to 1.5 inches deep depending on how big the baby is. So it's 1, 2, 3, 4, 5. And again, just that fast. 1, 2, 3, 4, 5. Just like we're delivering CPR compressions, 100 to 120 beats per minute. All right, we don't see anything in the baby's mouth. We're gonna go ahead and take our hand. We're gonna grab the baby's chin and our fingers and take care of that baby's neck. We're gonna roll the baby over to our other leg. And we're gonna deliver 5 back blows right in between the shoulder blades. Now, moms, don't freak out. You're gonna have to hit your baby pretty hard. It's not gonna feel like a normal hit, but we wanna dislodge whatever is in that baby's mouth. So it's 5 back blows with the palm of your hands in between the baby's shoulder blades. So it's 1, 2, 3, 4, that hard, okay? We're gonna turn the baby over again using our hand and cradling the back of that baby's neck and head and roll that baby over again to our other thigh. And we're gonna give it 5 more chest thrusts. 1, 2, 3, 4, 5. And again, repeating that with 5 back blows. 1, 2, 3. And again, rolling back over, 5 more chest thrusts. 1, 2, 3, 4, 5. We're gonna be looking for anything in the baby's mouth if and only if you can see a piece of debris in the baby's mouth. You're gonna take your pinky, your smallest finger, and you're gonna do a swipe. We're not gonna go in there and dig around. We're gonna just do a swipe. And if the baby still isn't breathing, we are gonna go right back in and go to our back thrusts and chest compressions. In the event that the baby stops breathing, we then need to begin immediately CPR. So we're gonna want that AED, and you're gonna wanna have that person come back that's called 911 with the first aid kit. Thanks for following along at Emergency Response Experts. And if you wanna take our full CPR, adult and pediatric class, check out our website at emergencyresponseexperts.com and sign up for one. They're super easy and affordable, and you won't regret it.